Thanks, Austin, and welcome back everyone to the State of the Science meeting on lessons learned from SSA demonstrations. This is session 7 on benefits counseling and case management. Vidya Sundar has prepared a paper on benefits counseling and case management and is going to be presenting on her paper for the next 15 minutes. After that, we'll have discussion by John Craigle and Leslyn Angel, and then we'll take a very brief break and return with session 8 on implementation. After session 8, we will have a combined question and answer period for both sessions, and that will start at approximately 5:30 Eastern. Now for Vidya Sundar on benefits counseling and case management. Take it away, Vidya.
Thank you, Sarah. Hello, everyone. My name is Vidya Sundar, and I'm with the University of New Hampshire. Today, I'll be talking about benefits counseling and case management within SSA programs. Next slide, please. So I want to start with the definition of benefits counseling and case management. Benefits counseling is a set of strategies, services, and supports that are designed to promote work preparation, attachment, and advancement. And here the focus is on enhancing self-sufficiency and independence by providing accurate information about benefits and work incentives. Case management is a complementary approach to benefits counseling, and it involves mobilization, integration, and coordination of care in low-resource environments. This definition is very similar to the National Association of Social Work's definition, which is what many SSA programs lean on to design their programs. It should be noted that SSA does not provide case management services outside of its demonstration programs. Next slide, please. So let's look at the history and policy setting of benefits management and case management programs. The Benefits Planning and Outreach Program, which was established through the Ticket Act in 1999, is really the foundational model for providing benefits counseling and case management. In this program, the focus was on providing one-time brief interactions or counseling services to beneficiaries. And there were some shortcomings with this particular program. There was some preliminary evidence that maybe the benefits counseling program was negatively impacting employment outcomes. So in order to address these shortcomings, the Work Incentives Planning Assistance Program was established in 2006. And this is operationalized through the Community Work Incentives Coordinators. And here the focus is on providing long-term support, building education and awareness and monitoring work incentives, and working closely with community agencies. Next slide, please. So next I'm going to be talking about some major findings from SSA demonstrations and other research outside of SSA demonstrations. In discussing the findings, I will not go into details about each demonstration program, and I will restrict my discussion of the findings to benefits counseling and case management. Next slide, please. So the first one is Benefit Offset National Demonstration, BOND. And if you remember, BOND was testing the difference between 3 groups: the Enhanced Work Incentives Counseling Group, the Work Incentives Counseling, and a control group. So beneficiaries in the Enhanced Work Incentives Counseling Group, EWIC group, received periodic and proactive check-ins from the counselors. They also got a written benefit services, a written benefit summary and analysis plan. They received an employment services plan and information and referral services. Beneficiaries in the WIC group received the written benefit summary and analysis plan, and the control group were services as usual. Unfortunately, there was no significant difference in employment and earnings between the groups, but one positive aspect of the study was that the telephone counseling was received well both by counselors and beneficiaries alike. Next slide, please. So PROMISE is the program that was focusing on youth, and it included 5 major components. And as you can see, benefits counseling and case management were 2 of those 5 components. Overall, there was a weak impact on employment status and earnings. And the challenge with PROMISE was that it was hard to disentangle the impact of case management services because of the way the services were bundled together. Next slide, please. State Partnership Initiative was a jointly funded program between the SSA and the RSA. And here states could choose from a menu of options, a menu of services based on barriers that beneficiaries experienced in their state. And the most frequent were benefits counseling, employment services, and Medicaid waivers. So findings suggest that benefits counseling was most effective when it was paired with employment service vouchers. It should be noted that a large percentage of beneficiaries in the State Partnership Initiative were individuals experiencing mental health issues, and that the intervention might have a differential effect on this particular group. Next slide. Accelerated benefits tested the impact of providing health insurance for uninsured SSDI beneficiaries, and specifically looking at the difference between insurance alone and insurance plus employment plus benefits counseling. So compared to the control group, there was some improvement in ticket to work enrollment, employment status, and earnings. Unfortunately, this impact dissipated by 3 years post-intervention, much like some of the previous programs. Next slide, please. Mental health treatment study focused on beneficiaries with schizophrenia and affective disorders, and it used the individual placement and support model, which is a model of supported employment, where case management and benefits counseling are integrated into the IPS. Beneficiaries in the treatment group had significant increase in employment status and earnings compared to the control group. But again, the impact of case management and benefits counseling could not be isolated because of the integrated nature of services. Next slide, please. So Project Network was an older demonstration that tested the use of case management, counseling, employment services, and some waivers to program rules. Under this program, there were several services offered to beneficiaries, like return to work, counseling, physical therapy, work assessment, etc. Findings suggest that there was an increase in earnings for the first 2 years, but again, that effect did not sustain beyond the 2 years. It should also be noted that there was a high cost to deliver case management services, given the range of services beneficiaries received under Project Network. Next slide, please. So next, we're moving on to findings from empirical research outside of SSA demonstrations. It should be noted that finding research outside of SSA demonstrations is really scarce, and a handful of studies that looked at the impact of benefits counseling and case management did so using SSA administrative data. So first, looking at benefits counseling, personalized attention, building rapport, and trust were important components of any counseling program. And the timing of services and providing early intervention was really important. And we talked about this at length during various sessions today. With regards to case management, there is strong evidence supporting different subpopulations, effectiveness within subpopulations, and that again is something that we've discussed at length today. Fidelity of implementation is really important when it comes to case management services, and I'll talk about fidelity in a bit. Next slide, please. So moving on to lessons learned and policy implications. Next slide, please. So in summary, it is safe to say that benefits counseling and case management programs are effective when they're paired with VR services. Just providing information referral services was necessary but not sufficient to impact employment outcomes. Coaching-based programs in general had a tendency to be successful rather than providing one-time information and referral-based services. Also, there was no clear consensus on the structure and components of benefits counseling and case management programs. And this ties with the fidelity concept that I mentioned earlier. And fidelity is really the process of ensuring that implementation and delivery of intervention is true to its original design. And that's important for quality control purposes. Next slide, please. So as far as future research and policy agenda, here are some recommendations. One is to learn more about what works for whom. And that's to say that we need to understand the differential impact on specific subpopulations. Two is to standardize models and define program components. And this also ties to the fidelity concept that I mentioned earlier. But this is not to say that we can tailor programs to meet the unique needs of beneficiaries, but rather that there should be some common elements or common denominators between programs so we can make comparison across programs. And three is to evaluate and design with self-sufficiency as the goal. And that begins by acknowledging that we need to focus on developing a career and not just placing beneficiaries in jobs. And if you think about this, the skills that are required for individuals to get hired at a job are really different from the skills that are required to sustain and advance in their careers. And along the same lines, when we think about options, workers have to increase their earnings potential. That comes from either increasing their hours or advancing in their careers. Now, with both these options, workers have to really advocate for themselves and also be open to asking and acting on feedback. They have to build new skills on the job. They have to continually meet performance requirements and manage their health and disability at the same time. And if you think about it, all of this requires a lot of mentorship and support at work. And it also takes a really long time. So that ties into the next recommendation, which is to think about long-term follow-ups. Again, in the context of earnings, looking at earnings potential, it takes time for people to build up their earnings potential and advance in their careers. So SSA needs to be thinking about demonstration programs that will follow up with people over the long term. Financial literacy training may also be helpful for some beneficiaries. Some beneficiaries have access to ABLE accounts for savings, but in addition to that, they may benefit from more training on budgeting and prioritizing expenses. Last, we need to be looking at motivational interventions, and these are interventions that address lack of motivation to work, fear of return to work, and these have been documented as common barriers for SSA beneficiaries. And SSA is already doing some work in this area with the exits from disability study, so further exploration of this topic would be beneficial. Next slide, please. So the next one is to embed and expand proven strategies. There is some good evidence about benefits counseling and case management among youth and some subpopulations. So SSA can spend their energy on developing programs and implementing these strategies with beneficiaries. The last recommendation is to consider interactions between programs and rules. Specifically think about what work incentives beneficiaries might be utilizing and when, and how these rules might mediate outcomes in the long term. The last bullet point is really a broad, big picture recommendation. Historically in the US, healthcare and social care services have been provided through separate siloed channels. We've heard about fragmented services quite a bit in the last hour. There are some newer initiatives, especially by the Administration on Community Living, to integrate these through two systems, through the Community Integrated Health Networks, CIHN, which takes a social determinants of health approach and tries to bring together healthcare and social care professionals, and that includes employment services. Another example of this can be seen within the mental health world, specifically within the assertive community treatment model, where a team that consists of psychiatrists, case managers, employment professionals, all work together as one unit, and there's sharing of information that happens in real time. And there's tremendous value in this sharing of information when the doctor says that, that this patient needs to have their medication changed, and that might impact how they feel groggy in the morning, or it might make them more sleepy. And the work rehab specialist is right there to absorb that information and possibly advocate for the client in their workplace, or come up with strategies that might help them to manage their change in medications. So this is an example of something SSA can keep their finger on the pulse in the long term and learn and leverage from. So those were the short-term and long-term recommendations within the within benefits counseling and case management programs. Thank you for your time.
Thank you, Vidya. Now we will hear from John Craigle.
Thank you very much. I'm excited to have the opportunity to speak with you this afternoon and to spend a few minutes discussing Vidya's very insightful paper and her presentation on benefits counseling and case management in Social Security's demonstration programs. Next slide, please. VCU has been involved as a prime contractor or subcontractor to Abt Associates on 4 demonstrations, 2 of which were just recently discussed in Vidya's presentation. These included the bond demonstration. We also were involved in the Promoting Opportunities demonstration, the Youth Transition demonstration, and the State Partnership Initiative. In each of these demonstrations, our role included attempting to standardize the delivery of benefit counseling services to establish the fidelity of intervention across multiple sites, establishing the fidelity of benefits counseling interventions across multiple sites. Next slide, please. Since 2000, VCU has also served as a Social Security funded training, certification, and technical assistance provider to the WIPA program. Since 2007, VCU has been the sole provider of Social Security's sanctioned training and certification efforts. I want to first point out that as Vidya described, the WIPA program has evolved in major ways since its launch in 2000. Social Security changed the WIPA service delivery model in 2006, and in our view, fully implemented the new approach beginning in 2009, when Social Security refocused the program as an employment support. So let's look quickly at some of these changes. Next slide, please. For example, WIPA programs currently receive approximately 75% of their referrals from the Ticket to Work helpline. Social Security has reduced the amount of outreach activities conducted by WIPA projects. This has dramatically changed the population of beneficiaries served by the program, focusing WIPA activities on beneficiaries working at the time of referral. Second, in recent years, over 70% of all participants referred to WIPA projects are currently working or have a job offer pending, and 90% of WIPA projects have a work goal after receiving WIPA services. Working beneficiaries, along with individuals between the age of 14 and 25 and veterans, are prioritized first for services from the WIPA projects. For comparison purposes, back in 2008, only 21% of program participants were working or had a job offer pending at the time of referral, and the prior BPO programs spent a large majority of their resources working with beneficiaries who were contemplating employment. I think that this might add to the subpopulation effects discussed earlier, looking where at the employment process an individual is when they begin to receive the work incentive counseling services. Third, WIPA programs provide a large percentage of their services remotely. This has occurred for several reasons. The WIPA projects understand the value of face-to-face counseling. However, they serve a large population of working individuals. And many of these individuals prefer remote counseling, as was mentioned, because of their work schedules. Work incentive counselors have much less time to travel given their large caseloads. In terms of the demonstrations we are considering, both the bond and the pod demos made wide use of remote service delivery of benefits counseling. 4, community work incentive coordinators serve a dynamic as opposed to static caseload. The average full-time CWIC works with over 150 new beneficiaries each year, somewhere around 3 to 5 new clients per week. About 2/3 of those individuals require in-depth work incentive counseling services. In contrast, in several demonstrations, work incentive counselors will work with a very large number of beneficiaries during the initial onboarding and enrollment process. Then their caseloads become relatively static or stable for the remainder of the demonstration. However, we've seen recently in POD, for example, multiple work incentive counselors in several sites dealing with caseloads of over 200 beneficiaries in the demonstration. In short, when reviewing the results of prior benefits counseling evaluation, factors such as referral source, employment status at referral, and caseload size must be considered. With all these factors, let me emphasize again, it's the counseling that's most important. It's the development of understanding, trust, and respect that is essential for effective services. Next slide, please. So how effective is benefits counseling in the absence of employment services and supports? In most demonstrations, benefits counseling services are paired with various types of employment services and policy waivers. Vidya did an excellent job describing the similarities and differences across the various service packages. However, not enough studies, in my view, have been conducted that focus exclusively on the benefits of benefits counseling services alone and in isolation. There have been a couple studies that have been done on the WIPA program, tracking cohorts of people for short periods of time or long periods of time. But I think we should look at why benefits counseling might be beneficial for certain groups of people. Next slide, please. Benefits counseling addresses some, but not all, barriers to employment for Social Security disability beneficiaries. I reviewed several demonstration reports to look at barriers to employment identified by participants. These barriers obviously included a variety of obstacles, many of which are described by Vidya in detail, such as current health status, help finding a job, etc. But three of them I think are particularly important when you're looking at benefits counseling: fear of losing benefits, fear of losing health insurance, and fear of overpayments or sudden benefit loss. If the demonstration is focused on beneficiaries with limited prior employment experiences who can request employment services and supports, such as some transition age youth, then benefits counseling by itself may be a necessary but certainly insufficient service. However, benefits counseling can be very effective at providing accurate information that will lessen beneficiaries' concerns about increasing their earnings and can provide assistance that can alleviate benefits issues when they may arise. We shouldn't assume that these fears are irrational. They do happen. Even when beneficiaries are attempting to follow all the rules, or when they do follow all the rules, or when they occur, they can be devastating for people's careers in terms of overpayments, termination of benefits, and other related issues. Next slide, please. Benefits planning in SSA demonstrations. I would basically argue that benefits planning in SSA demonstrations frequently has several weaknesses. First, there's a lack of standardization that makes it difficult to aggregate data across programs or sites. There should be fidelity standards to ensure all sites included in an analysis meet a basic level of treatment fidelity in order to be included. Otherwise, instead of saying we had one that was very much an outlier, but we're going to include them in the analyses as well. Next slide, please. The benefits of the benefit planning treatment fidelity in terms of what we've tried to do recently has multiple parts. We agree on the standardization of training. All counselors receive the same rigorous testing that leads to certification in the delivery of work incentive counseling. There are development of Social Security approved service delivery protocols, from ongoing and engagement protocols to information gathering to obtaining the BPQI to report development and offboarding. There are web-based training modules that outline rules pertaining to particular components of a demonstration that might include waivers for offsets, referrals, and that type of thing. And then we provide intensive bi-monthly national webinars, intensive 2 technical assistance video conferences each month with all site members. We do follow-up of monthly individual counselor video conferences for case reviews, and use that as the mechanism for attempting to maintain the integrity of service delivery across multiple projects. Thank you for this opportunity to share this information, and look forward to talking with you further.
Thanks, John. Now we'll hear from Leslie Angel.
Good afternoon. My name is Leslyn Angel, and I am the president and CEO at Michigan United Cerebral Palsy, MyUCP. I am delighted to be part of the panel discussion for today and to have the opportunity to provide feedback on Dr. Sunder's presentation, Benefit Counseling and Case Management. This is such an honor for me because for the past 22 years, I have had the opportunity to be directly involved with projects that include BPAO from the very beginning, WIPA, which I'm currently involved in, the bond demonstration project, and now the POD project. Therefore, my perspective comes directly from working with SSI and SSDI beneficiaries, as well as providing supervision to staff who have worked on the demonstration projects, providing direct case management, benefit counseling, and the combination of both. Over the past 40 years, SSA has conducted many demonstration projects which have incorporated benefit counseling and case management. And for most of those demonstrations, the goal has been to identify ways to help reduce the number of individuals on the SSA rolls. But that has continued to be a challenge. And as we see the number of people receiving benefits continuing to grow. In 1999, through Ticket to Work, benefit counseling was recognized as a core service for those receiving SSI and SSDI. But since the Ticket to Work in 1999, benefits counseling has transitioned, as John mentioned. We have moved from the model of the BPA and O project, which was more of providing accurate information to individuals, to where we're focusing on doing more than just providing accurate information, but focusing on providing counseling services and supports to individuals who are actively seeking work or have a work goal in mind. We know that the implications that Ticket to Work had for so many beneficiaries was major. It has really given the opportunity for people to have greater choice through in the employment networks, through choosing to be part of benefit counseling. We also know that both the SSI and SSDI programs provide economic security for so many people who are living below the federal poverty level. So the idea of just working in itself often comes with challenges. People have often waited months or sometimes years to become eligible for benefits. So it is truly a scary reality. So promoting employment and economic stability is a challenge from the very beginning. In Dr. Sundar's findings directly related to bond, promise, state partnership systems change initiatives, the SPY project, accelerated benefits, mental health treatment study, and project network, we learned that supporting various populations require different approaches. So using a one-size-fits-all approach to supporting individuals receiving benefits will more than likely not garner positive results. We learned that incorporating a person-centered approach based on the person's individual circumstances will get those best results. As we compare the utilization of benefit counseling and case management, or the combination of both, we learned that incorporating case management works well for specific populations. We also know that the navigation of the complex Social Security rules is very difficult for the average person. So having trained benefit counselors is critical in providing much needed information. As Dr. Sundar discussed, there is also evidence that case management works for certain populations, such as those with mental illness. And if both benefits counseling and case management are paired with VR services, that it's often most effective for many populations. If we place a greater emphasis on subpopulations and identifying what works and what does not work, we will likely have a greater impact on service delivery. Dr. Sundar also indicated that the need to promote self-sufficiency through financial literacy is another important tool. But I think, as it was brought out earlier today, many of the folks who I've worked with and who my staff have worked with often experience other issues aside from gaining financial self-sufficiency. They have so many other barriers to employment that, again, there are so many challenges that need to be directly addressed. It's also recognized that timing is an important factor. For example, working with transition age youth and incorporating benefit counseling as part of the transition plan can make the process of handing that individual off to a VR counselor one that is so much easier. Also, as discussed in the earlier presentation on early intervention, meeting people at the right time is important. And it was discussed looking at the beginning of eligibility and providing benefit counseling and case management. That is something that is definitely worth exploring. In conclusion, it is clear that both benefit counseling and case management, coupled with employment supports and addressing other barriers related to employment, is critical. And as John mentioned, as we look at benefit counseling and having been involved with benefit counseling for over 22 years, it is clearly recognized that benefit counseling can be extremely beneficial for beneficiaries. And I think, again, looking at that individually and how that can impact and really look at measuring and studying benefit counseling in itself. I also feel that benefit counseling or case management without benefit counseling is definitely not a direction that we should go in. Again, understanding those benefits are critical and important for people to even consider to return to work or go to work. Thank you.
Thank you, Leslie. Thank you to all of our presenters. We're now going to take a short break. We'll be back for session 8 at 4:55 Eastern. See you soon.
We will begin shortly.
Welcome back, everyone, to the State of the Science meeting on lessons learned from SSA demonstrations. This is our final session of the day, to be followed by a question and answer session and then some concluding remarks. In this next session, we have a recorded video as one of the presentations. So it's even more important to connect via your laptop or desktop computer to either use the desktop app or application out of the browser, because the audio will not be audible unless you're using that computer link up. So we will still be taking questions in the same way as before with that question and answer button in the lower right-hand side of your computer, and we will come back to those questions and answers at the end. But let me now turn it over to Sarah Brunovitz, our chair for this last session.
Austin, Austin covered most of the introductions for the session, but I want to let everyone know that this is now session 8 on implementation and SSA demonstrations. We're going to be hearing about a paper by Debbie Engler and Michelle Wood on this topic, and we're going to be viewing a pre-recorded video by Michelle Wood. After this presentation, we'll hear discussion by Dave Stapleton and Calvin Johnson, and then we'll have a period of question and answer. So I think we can load up the video and go ahead and get started and be joined with Michelle Wood through recording.
Good afternoon. My name is Michelle Wood, and I'm from Abt Associates. My co-author for this chapter is Deborah Getz Engler from the Social Security Administration. I just want to start by noting that our chapter and today's presentation do not reflect the opinions or policy of the SSA. The presentation is based on our own analysis of SSA's demonstrations. Next slide. So what I'd like to do today is walk through the headlines from our summary of implementation lessons. I'll start with some context, followed by lessons about recruiting and enrolling participants and also implementing interventions. Next slide. Next slide. Because impact analysis alone isn't enough to explain why a particular intervention does or does not have the effects that we observe, it's also really important to study implementation. The implementation analyses describe the processes and operations of the intervention, and they answer a variety of questions. Things like, how did the intervention operate in practice? Was it implemented as intended? What were the economic conditions in place at the time? What services are typically available? Policymakers can use answers to these questions to interpret impact findings and also to draw lessons about how to enhance future demonstration design. For the chapter, we found it really helpful to group the demonstrations into categories based on the kinds of implementation lessons that we saw. The first group are the earliest demonstrations that took place in the 1980s and 1990s. These demonstrations highlighted the feasibility of recruiting and delivering services to the SSA population. Next are the demonstrations that test alternative earnings rules for calculating SSDI benefits in the form of benefit offsets. Next slide. The third group are demonstrations that offered specialized services, things that are outside of SSA's normal operations, like case management, health insurance, and supported employment. And the last group are the early interventions, and they take place before receipt of SSDI and SSI benefits. Next slide. So now we'll take a look at some lessons from recruiting and enrolling demonstration participants. Next slide. So when we look across demonstrations, we see that enrollment varies. And what this slide shows is the proportion of eligible individuals who enrolled. We think that a combination of factors explain differential enrollment. Differences in the target population, the nature of the intervention, and the recruitment methods that each demonstration used. I'll just point out a couple of things on this chart. At the top, you'll see accelerated benefits. And for that demonstration, a very high proportion, 98% of the eligible individuals volunteered. Now, this is a very specific target population. These are new SSDI beneficiaries who do not have health insurance. And what they were offered is health insurance during the 24-month Medicare waiting period. The recruitment process involved a good deal of eligibility screening. And once the researchers narrowed it down to this very specific target group, a very high proportion volunteered. And they volunteered to receive an intervention that's very concrete and also likely very valuable to them. The youth demonstrations, and you see those on the chart, they're labeled as PROMISE and YTD for youth transition, also have higher enrollment than other demonstrations. And we think that youth might be really motivated to pursue employment and also get encouragement from their families. Outreach to broader cross-sections of the SSDI and SSI populations, and you see those on the chart as Project Network, BOND, and POD, have attained lower enrollment, between 2.4 and 5.5% of eligibles enrolled. And we think that these interventions offered in these cases might seem more abstract to potential volunteers. In the case of BOND and POD, people are offered a financial incentive that might potentially increase total income when earnings increase. It might seem less certain to beneficiaries and also potentially less valuable than other services. In the chapter, we compare recruitment methods. I'll just highlight a couple of things here. First, we found differences in the use of in-person processes in recruitment. The mental health treatment study in SED required in-person components to recruitment because of the intervention. The BOND program and the PROMISE programs also used in-person meetings as part of recruitment. But Accelerated Benefits, Youth Transition, and POD did all of the recruitment by mail or phone. Second, we also found, particularly as we reviewed the PROMISE program implementation studies, that there seemed to be advantages to assigning dedicated staff to conduct recruitment rather than having the same staff do recruitment and service delivery. Next slide. In the chapter, we summarize a lot of demonstration findings that compare volunteers to non-volunteers. One key example is that volunteers in the offset demonstrations are more work-oriented than non-volunteers. Next slide. 4 of the demonstrations, Project Network, the New York Work State Partnership Initiative, the Mental Health Treatment Study, and Supported Employment Demonstration, conducted additional analysis of recruitment to examine the characteristics that predict enrollment. And one example is the New York Work SPY project. The researchers for that project broke out the enrollment process into 4 stages, and they examined outcomes of enrollment at each of those stages. And what they found was that younger SSI recipients were more likely to decline to participate because they did not respond at the initial stage to the very first outreach letter. They also found that SSI recipients with anxiety disorders who expressed an initial interest in the project were more likely to drop out at the enrollment stage than were SSI recipients who had other types of psychiatric disorders. So we think that this type of assessment of participation, particularly if it examines a wide range of characteristics like education, race, and ethnicity, could be very helpful to explore possible disparities in enrollment and to understand whether some steps in the enrollment process are less accessible than others for particular groups. Next slide. So now we'll turn and look at some lessons about delivering services and other types of interventions. Next slide. First, we found that interventions that change the earnings rules that determine SSDI benefit calculations in the form of a benefit offset pose some unique implementation challenges. One challenge is in making timely adjustments to benefits. Beneficiaries' earnings reporting and operational backlogs can make it difficult to make timely benefit adjustments. And that in turn might diminish the behavioral response to the benefit offset. Another area of challenge is the complexity of both current law earnings rules and the benefit offset rules. Both the BOND and POD demonstrations found low understanding of current earnings rules in the control groups, as well as low understanding of the benefit offset rules in the treatment groups. Next slide. So now I'll turn to some lessons about offering specialized services that are outside of SSA's normal operations. One approach that SSA has tried is to deliver highly structured evidence-based services, like the individual placement and support intervention. This was analyzed in the mental health treatment study and is in the field right now with the supported employment demonstration. The mental health treatment study was the first time that IPS was tested with SSDI beneficiaries on a large scale across the US in community-based mental health centers. The study showed that it is possible to deliver IPS with high fidelity in these settings and to these participants. And the key to doing so was careful site selection and rigorous monitoring. But an area where we think additional research could be useful is about whether it's possible to alter any of the requirements of IPS and still achieve participant outcomes. In mental health treatment study, the site level fidelity wasn't associated with participant outcomes, as had been shown in other studies. It might be because there wasn't enough variation in site level fidelity to detect any effects. But we think that research that intentionally tests whether less stringent application of IPS could produce outcomes might also be useful, especially as IPS is expanded to other areas. Next slide. So in contrast to the highly structured evidence-based services, SSA has also used demonstrations to build evidence about new approaches, requiring core program requirements, but offering local flexibility to customize design and implementation. The two main examples of this are the youth demonstrations, YTD and Promise, but Retain also uses this approach. So on the one hand, this kind of local discretion promotes innovation and flexibility. For example, the arrangement allows programs to take advantage of local strengths, services that are already in place and existing relationships, which can make it possible to get services in place more quickly. The arrangement can also offer flexibility to tailor services. We noted that in several of the Promise programs, the programs were able to hire additional staff or modify a component of service or a mode of service delivery in order to respond to unanticipated developments or to increase take-up. However, on the other hand, this flexibility can also make it complicated to compare results across programs or to pinpoint what exactly achieves the results. So this type of arrangement puts a real premium on conducting a rigorous process analysis that documents the variation across sites and collects uniform data. Next slide. In the chapter, we discuss factors that hinder and enhance service delivery. Something that we read over and over again in the implementation analyses was that service providers frequently found that participants faced crises or had basic needs. For example, they might have faced housing crises or needed basic services like food, transportation, or healthcare, and that these crises and service needs made it difficult for participants to engage with the demonstration services. A couple of things, the programs also found some tension between meeting the requirements of the intervention and meeting these needs for basic services. A couple of things really seem worth considering. First, building in flexibility for service providers can help. And it also helps when addressing these kinds of basic needs are included in the design of the intervention, as is the case in supported employment demonstration and mental health treatment study. Next slide. Other factors that enhance service delivery had to do with communication and leadership. These two things really stood out in demonstrations that evaluated third-party assistance to help people experiencing homelessness to navigate the SSI application process. Investment from organization leaders and a really structured contact and communication process among the third-party organization, the SSA field office, and the Disability Determination Service seem to have been essential to the success of these demonstrations. Clear roles and expectations among all of the partners also helped. The demonstrations found that assisting underserved populations increased approval rates at the initial level and reduced the time for benefit award. We think this lesson is especially relevant today as SSA responds to the decrease in applications resulting from the COVID-19 pandemic and the need to reach underserved populations. We think SSA can build off lessons from the SSI outreach demonstration, HOPE, HSPD, and the SOAR projects in these efforts. Next slide. So finally, to summarize, taken together, we think that there are a lot of successes in implementation. SSA has had success recruiting different groups, delivering services using a variety of arrangements, and in some cases partnering with state and other federal agencies. There have also been some challenges, particularly related to the earnings reporting and benefit adjustment operations that are needed for benefit offset demonstrations. Overall, our review of the demonstrations implementation studies shows a lot of success in conducting credible tests of a wide range of interventions. We think that any absence of intervention effects does not appear to stem from implementation challenges. And finally, we think the implementation analyses are a crucial part of these projects. I haven't had time to go through all of them here today, but our chapter contains many other examples of lessons that we think can be applied to future demonstrations and to policy. A couple that we've highlighted are about analyzing factors that predict enrollment at different stages and taking account of the basic needs of participants in intervention design stage. Thank you very much.
Thank you for that presentation. We're going to move on to comments from Dave Stapleton. So Dave, if you could turn on your camera.
I did. You don't see it?
Maybe we need just a minute to
There
get
we
things
go.
set up.
There
There
we
we
go.
go. Now we can see you.
Okay,
Okay.
so I have to warn you that we're about to get hit by a thunderstorm. So at best, you're going to hear some thunder in the background. At worst, I'm going to lose my power. So let me go ahead through here. So for context, I've been conducting research on employment of people with disabilities for almost 30 years, much of it related to SSDI and SSI. Michelle and Deborah deserve a great deal of credit for drafting an extensive and valuable review of the implementation experiences from several decades of SSA-supported demonstration projects. I've been significantly involved in 3 of the 12 demonstrations they reviewed as a designer and an evaluator, and sometimes with Michelle and Deborah. Although that means I knew a lot about implementation before reading their paper, I've learned a lot more. The many implementation lessons they have drawn via careful comparison of experiences across demonstrations strike me as fundamentally correct. So rather than critique their lessons, I'm going to suggest some of my own. These lessons draw on their lessons in various ways, and they focus on strategies for optimizing the value of SSA's demonstration and research resources going forward. So the first point I want to make is their findings reinforce a view I've held for a long time, and that is that SSA employment demonstrations should focus exclusively on testing relatively early interventions designed for people at risk for application or applicants themselves and new beneficiaries, rather than designed specifically for longer-term beneficiaries. Several other speakers today have essentially made the same point for various programmatic or policy reasons. But the author's first implementation finding adds a very practical argument in favor of testing early interventions, and that is that past demonstrations that have targeted SSI youth, applicants, and new beneficiaries have all achieved much greater recruitment yields than those that have recruited the broad adult beneficiary population. There seems to be more interest and more capability to recruiting those individuals. My second point is that SSA tests of any intervention should initially be targeted at narrowly defined groups for which the intervention is most likely to yield substantial impacts. Now, this is related to comments made earlier by Robert Moffat and Tovon Wachter and Howard Goldman. But until we know that an intervention works well for a group for which we expect it to work well, we needn't worry about whether it will work for other groups. If evidence shows that an intervention works well for a narrowly targeted group, it then makes sense to expand tests to other groups. The author's recruitment findings reinforce this view. Recruitment yields are higher when populations most likely to exploit an intervention are targeted. The accelerated benefits in the promoting opportunity demonstration are at polar opposites in this regard. The enrollment yield for accelerated benefits, as Michelle said, was 98%. They were targeting uninsured SSDI awardees. The enrollment yield for POD, which targeted all SSDI beneficiaries, the bulk of whom we know are not going to be interested in the intervention, was just 2.4%. My next point is a follow-on point. It is potentially worthwhile to expand tests to other populations when and only when a demonstration achieves favorable results for a narrowly targeted population. The authors point to a string of SSA demonstrations that illustrate the value of expansion following an initial success concerning approaches to reducing barriers to SSI and SSDI entry. I also think that SSA interventions for youth can arguably be characterized as gradually building on initial successes, as Dave Wittenberg has described. And Howard has talked about the value of expanding tests of IPS, which has already been demonstrated to be quite successful in the case of serious mental illness. I want to use BOND to illustrate the opposite, why SSA should not test an intervention on a broad population until favorable results have been found for a more targeted population. SSA did, in fact, test the BOND benefit offset, something very close to it, on 4 target populations for which the offset was expected to have substantial impacts under something called the Benefit Offset Pilot Demonstration, or BOPD. Each of these 4 RCTs recruited beneficiaries who had signaled an interest in work via an interaction with a specific state agency. One of the 2 unfavorable results from BOPD was in the implementation domain, as Michelle and Deborah have pointed out. There were major problems in the processing of benefit adjustments that led to mistakes and long delays in the adjustment of benefits for the treatment subjects in the BOPD. The other unfavorable findings are based on the impact analysis from Bob Weathers and Jeff Hemmeter. There was no significant impact on mean earnings, and there were positive impacts on mean benefits. Now, purely from a research perspective, I now think it was a mistake for SSA to move forward with bond, given the unfavorable BOPD findings. I know that SSA expected to fix the implementation problems identified under BOPD prior to the implementation of bond, and was under great pressure from Congress and others to move forward. But the bond evaluation findings are unfavorable in the same ways that the BOPD findings were. There were large problems with implementation of the benefit offset, and despite enormous efforts to fix them. And also, as Robert Moffat previously pointed out today, impacts on mean earnings and mean benefits were not favorable in the same way that they were not favorable for BOPD. Although I don't think it would be fair to criticize the agency for moving forward with bond despite the unfavorable findings from BOPD, I think it is at least arguable that SSA would have learned more and saved time and valuable resources if it had instead pursued a second set of narrowly targeted demonstrations designed to verify that the implementation problems could be adequately addressed, and if so, that the impact results would be more favorable. Despite all of the research that we've had on the benefit offset, to this day, I cannot confidently rule out the possibility that better implementation of the bond benefit offset would result in much more favorable impacts. I think Michelle might disagree with me on that point, but I think it's at least arguable. So my next point is that SSA demonstrations need high-quality implementation partners to be successful. This may be obvious, but it is so important that it deserves explicit attention. Other speakers today have spoken about the value of SSA collaboration with other federal agencies, state agencies, and private organizations. Michelle and Deborah point to attributes of partners that are important to success, including leadership, strong working relationships among partner organizations, ability to innovate, ability to implement an intervention with fidelity, ability to make mid-course corrections, and ability to support recruitment. SSA's experience provides many examples of the importance of these attributes. In revising the chapter, I think it would be helpful, and I would encourage Michelle and Deborah to review and draw lessons from the many different approaches that SSA has taken to engage partners, to find the partners in the first place, to reach agreements with them, contracts, or cooperative agreements or grants or whatever. Finally, the authors point to the need for SSA demonstrations to include and potentially test novel ways to address two limitations on the ability of some disadvantaged individuals to make use of the tested interventions. The first limitation is the ability to access information technology. Broadly speaking, the pandemic has accelerated the pace of improvements in infrastructure and methods to deliver virtual services. It's also heightened awareness of the need to increase access of the most vulnerable populations to information technology. The Wisconsin Promise demonstration did this by providing tablet computers and data plans to students in rural areas. I've come across another instance of providing tablet computers that seems to have helped a lot in rural areas. And so I think that going forward, it would be great if demonstrations systematically did the same for many other services, such as applications of earnings rules, benefits counseling, and delivery of early interventions. The final point concerns meeting the unmet basic needs of individuals. Interventions that are designed to help participants temporarily meet their basic needs so that they have the bandwidth to take advantage of the intervention seem more likely to succeed than those that leave such needs unmet. And I think it's really important that demonstrations going forward do this when subjects in the intervention have many other unmet needs. This really relates back to the point made by Jeff Liebman of suggesting that SSA always include a control arm in which participants receive a cash stipend that's equivalent to the cost of the main intervention. That's it. My time's up. So thank you very much for the opportunity. I hope my comments have helped a little bit, and I'm sure this chapter adds great value to the whole enterprise of the book.
Thank you, Dave. Now we will hear from Calvin Johnson.
Great, thank you. Thank you for taking me off mute. I couldn't find the button. In any event, thanks for having me. I'm I'm actually delighted to be here and to share thoughts on the chapter that's been written. I'm going to kind of just talk about this from the work that we're doing at HUD. And as I was reading through the chapter, I couldn't help but to kind of look at some of the challenges that we're facing and try to make the connection between some of the implementation challenges that were in the chapter. So specifically, I want to talk about 3 areas. One is about recruitment. The other one is about collection of services as an intervention. And the final point that I want to talk about is planning for long-term tracking. And so first, let me start off with response, recruitment, and take-up. And so as we have heard from the presenters, the implementation of demonstrations as a tool for evidence building is challenging. We are all dealing with this. Among the challenges is getting enough people to respond to a notification announcing the demonstration. And we all know that without sufficient response to a notification, there is not enough to study. A key component of this challenge might be how much we know about and understand the ways in which targets of a demonstration experience the services we deliver or are administered through an intermediary. And perception is everything. Now, we might say that it's reasonable for targets who actually perceive the existing service delivery as less than desirable to be less than inspired to respond to recruitment notices for a demonstration. It is equally reasonable that targets who have a similar perception of existing service delivery might be inspired to actually respond to a recruitment notice, hoping that their involvement with the demonstration or in the demonstration will result in improvements both in terms of service delivery and the provision of benefits. Now, that's saying that that's the way that the world works or that's the way that things are, but it's reasonable. Maybe the most reasonable expectation is that targets do not find participating in demonstrations to be fun at all, right? And that's just the way that it is. Now, we can go down a continuous path of what motivates targets to actually respond to our recruitment notices, but we know that effective recruitment is an evaluation hurdle that we must clear. So we have to clear effective recruitment. We have to clear that hurdle. And I believe that we need to spend more time, perhaps during our implementation evaluations, understanding the relationships between perceptions about our programs and responses to our recruitment efforts. Now, this raises questions about how much do we know about how beneficiaries perceive our programs? And when we reach out to them about a demonstration, what behavioral insight do we have to actually effectively promote participation in our demonstrations and increase response rates to our recruitment efforts? Now, let me spend the balance of at least this first section. Let me spend the balance of the time on this first section focusing on where I believe behavioral insight might be helpful with respect to demonstrations recruitment efforts. Like SSA, HUD works with GSA's Office of Evaluation Sciences to bring behavioral insight to bear on low-cost, light-touch nudge experiments. HUD's interest in the use of behavioral insight is to test varying approaches that might inform outreach efforts or the way that we message information to a beneficiary of our programs. More specifically, are there better approaches to delivery of information and better messaging of the information that will motivate beneficiaries to take an action, like respond to a recruitment effort, get kids to school on time, or get kids to school more regularly, applying for financial student aid, consuming less energy, among other things. Now, we spend a lot of time trying to understand whether there is varying impact of nudge messaging, that is the way that information gets disseminated. And we spend a lot of time thinking about that by mode of message delivery, whether it's by mail, postcard, versus letter, email, text, phone. We even customize messages and say, hey, look, perhaps we put it in a personal voice, perhaps we use the official voice. We also think about the messenger, like who's really delivering the message, right? So is it a celebrity, someone who's well known, a trusted public official, a government agency responsible for actually administering the program? And although this might be to some, boring work, it is the basis for which we convey, hey, you want to participate in this demonstration. It is hard work. And I applaud SSA, and particularly I really enjoyed the chapter and the authors. I applaud them for kind of pointing this out and talking about some of the challenges that we face in terms of recruitment. Now, I I imagine we could take the same approach to understand responses to recruitment efforts. That is, we can think about, do we know what it is that beneficiaries or their representatives might kind of feel towards the organizations who are actually administering the program? Is there a trust issue with the organization, even when the organization is trying to help? We also know that in many instances, incentives are effective ways of getting individuals to actually participate in demonstration, especially with respect to the time commitment that is often involved. And so we can kind of go down that path, but I want to just say that we could potentially think about running a series of experiments to test how beneficiaries respond to messaging, mode of delivery, messenger, and recruitment incentives. We can vary the message so that we can learn whether there is specific content that results in greater response. We can think about differences that we might see in terms of mode of delivery. And we can also determine whether it matters who the messenger is and who's doing the outreach and the recruitment. Clearly, we want to understand how this plays out across demonstrations and whether there are observable patterns for specific classes or groups of interventions, as well as for target populations across interventions. The challenge here, however, is perhaps, we have to realize that what we learn today might not be applicable 5 years from now or 2 years from now. So we got to keep at this. Now, for the balance of my time, I'm going to just have a few minutes to talk about these next two areas. And one is the collection of programs, is a collection of program services as an intervention. And so in many instances, we have an intervention that is a collection of services. So when we think about economic self-sufficiency, we think about financial literacy, skill building, time task management, job search coaching, resume writing, and interviewing. And as we design demonstrations that have a collection of services as the intervention, we need to ask ourselves whether there is value to understanding what each component contributes. So we might start by thinking about whether there is room to start pruning services during the demonstration and learn whether pared down collection of services might be effective or as effective as large collections of services. Do we need to implement the full and pared down model of the intervention at the same time, or can we administer them iteratively? That is, do we learn, do, and then pare down, right? Or do we learn, then do again, and then pare down? Essentially, we need to consider whether what we want to learn will require a more iterative learning approach whereby the demonstration is taking advantage of prior learning and building that prior learning into the demonstration. Then finally, really quickly, just wanted to talk about demonstrations with a focus on long-term impact. So often we're interested in understanding the longer-term impacts of an intervention or interventions. And so I'll briefly talk about a few things with the minute or so I have left here. So as part of the evaluation plan, we need to clearly identify outcomes of interest and determine which are primary and secondary, or which are primary and which are exploratory, and then determine, which are the ones that we want to track over a longer term. And when we draft our informed consent, we need to also make certain that the sunset period is appropriate given our data collection efforts. So we don't want to have our informed consent sunsetting on us at a time when we believe that there is greater value in the collection of longer term outcomes. And our ability to assess longer term impact assumes that we have implementation procedures in place to stay in contact with program participants well beyond the initial baseline and follow-up periods. And so we need to be thinking about a strategy for doing that. And then finally, tracking participants' hearts. So the implementation plan should have contingencies built in for interview data collection that consider a priority benefit cost decisions that really hinges on our ability to track folk and stay in contact with them over time. And those contingencies also need to think about, well, where is the greatest value in case you don't have enough response rate in those that you have been tracking. So I'll stop there. Thank you.
Thank you, Calvin. And thanks to all the presenters. Now we're going to enter a question and answer period for both sessions. So I'd like to start by giving the authors an opportunity to respond to any comments from the discussants that you'd like to respond to. So Vidya, would you like to go first, or is there anything you'd like to respond to from your discussants?
Yeah, sure. Thank you, Sarah. I first wanted to acknowledge John's comments about how the WIPA program has been responsive to the evolving needs of beneficiaries, and how it now includes phone counseling and managing high caseloads. I also want to point out that VCU has done a tremendous job in standardizing the training for WIPA counselors, and somehow we have to be able to take lessons from that program and be able to implement that in the actual implementation situation. And Leslie, thank you for sharing your insights about barriers to employment and your suggestion that a one-size-fits-all solution for case management and benefits counseling will not work. That's really valuable. And you pointed out the need for services to be person-centered, and I also want to acknowledge that. So thank you both.
Thanks, Vidya. Michelle and Deborah, would you like to respond to your discussants?
I think both, I wanted to thank both Calvin and Dave for their really thoughtful and detailed comments. It's really helpful, and we'll definitely use this as we revise and review our paper again. A couple things, and I could note, and then Debbie might have some ideas as well. I thought it was really interesting, the comments Calvin made about recruitment and understanding reactions and of beneficiaries and perceptions, and ways to learn about that and to use that information to inform recruitment methods. In the paper, we talk a little bit about some of the work that SSA is doing with the General Services Administration to test behavioral, to test these rapid informational interventions, and there's been a lot of findings already, some really important insights about simple information going out to older people who are eligible for SSI to try to encourage application for SSI that's seen some important results. And one of the things we found as we reviewed the implementation studies, some of the demonstrations have actually tried to understand reasons for not enrolling. Like they've actually tried to, talk to people who've chosen not to enroll. And that's one of the things that was strongly recommended by the researchers in the New York Works SPY project as a way to understand. And the demonstrations that have looked at those things have really found that beneficiaries' concerns about the complexity of rules are an important factor. Concern about the legitimacy of the offer, the trust issues that you mentioned are also important. And so I think that is definitely something that we came across as we reviewed the studies, and that we can even highlight even more. And definitely thinking ahead, thinking early on about how to set up demonstrations and position the demonstration to collect longer-term follow-up data. Doing informed consent in a way that permits longer-term follow-up can be really important, especially for demonstrations, particularly for demonstrations that are targeting youth, but other populations where findings might take time to manifest. So that seems really important to look at. And really appreciated David Stapleton's comments. I think particularly we were, as Debbie and I reviewed findings, it was really interesting to note that the accelerated benefits was a demonstration that sort of tried a telephone mode of providing services kind of out of necessity, because that demonstration was operating in a large number of metropolitan areas. But the timeliness of that kind of lesson, given service provision concerns now and in the COVID-19 pandemic, is really important. I think I think that's really important, and we definitely will take your advice to delve a little deeper and talk about lessons from SSA's work to engage with different partners. Debbie, did you have anything else you wanted to add on the comments from Okay,
Thank you.
but thank you very much.
I'd like to ask a question. We've received several questions about overpayments over the course of the day, and kind of relocated them to this session because they seem most relevant to this session. What is the role of overpayments in benefits counseling and case management? And that's directed at Vidya. And then what's the importance of overpayments in terms of implementing demonstrations? Or what role could overpayments play in intervention success? So Vidya, if you'd like to take the first half of the question that's focused on benefits counseling and case management.
Yeah, sure. Based on my understanding, it seemed like there was definitely some confusion among beneficiaries when it came to overpayments, and that had an impact on how the counseling services were provided, because there was also some implementation challenges and misunderstanding. So there was certainly a clouding of impact that the overpayment problem had within bond. I would go back to thinking about how the program can be implemented in a way that it provides adequate information and training and resources to both the counselors and beneficiaries themselves, so they're aware of and they can manage that better.
John or Leslyn, do you have any comments on the topic of the importance of overpayments for benefits counseling and case management, or benefits counseling and case management for the topic of overpayments? Relationship goes in both directions. All right, hearing no response, Michelle and Debbie, would you,
Sorry, this is something that Social Security has focused a lot of attention on in the design and the implementation of the demonstrations. Overpayments are a very real thing. In a particular situation where we're trying to adjust benefits on a month-to-month basis, Social Security has designed a lot of things to facilitate that happening, lots of internal processes that they've developed. Also, within the administration of the demonstrations, there are offices that act as the prime contractor staffs to facilitate the processing of that. And then the benefits counselors, the work incentive counselors, have a role as well in terms of dealing with overpayments that relate to specifically to has the individual reported earnings accurately and timely. And then when when overpayments occur, then the counselor can assist in helping the individual develop a plan for dealing with the overpayment and that type of thing. The WIPA rules are that the benefits counselors cannot represent somebody, for example, in a appeal, but they can assist the individual and answer their questions related to the development of a waiver request for an overpayment.
So yeah, I would just second what John noted in the benefit offset national demonstration and bond. The benefits counselors were such a key component because they could also explain to beneficiaries how the offset rules work and kind of help prepare beneficiaries for how benefits might be adjusted. But definitely overpayments are a concern for beneficiaries under current law rules as well. And I think that information and that benefits counseling provided through the demonstrations was an effort to try to help mitigate and try to encourage. I mean, there are a lot of components that go into it. Beneficiaries need to report earnings timely. There's a lot of, in current law, but also then in demonstration, when new earnings rules are being tested, there are a lot of operational steps that have to be taken. There have been some efforts. The POD demonstration simplifies some of the earning rules more so than bond, and that's been an attempt to to try to simplify the process. That demonstration has also experienced some overpayments, but I think, as John said, having benefits counselors who understand the rules and are working closely with beneficiaries can help to explain the process and help them in any information that they need to provide to SSA.
Thank you. Our next question coming from the audience is how would employers, recruiters, or other business-facing groups best be included in interventions designed to connect beneficiaries with work, either in a demonstration or in a new policy? And what kind of outreach might be needed to include these parties? And how could that take place?
Yeah, that's a really good question. When you think about including employers and recruiters who are reaching beyond the traditional networks that SSA demonstrations have included in the past, one strategy that I can think of on the top of my head is maybe working close to home and thinking about federal employers and contractors who might experience disabilities and just working within federal government programs and thinking about how you might support workers with disabilities, and think of that as a test environment to conduct outreach and demonstration programs, and then go from there. As far as the impact relative to case management or healthcare-based interventions, I don't necessarily see that as one versus the other or competing against each other. These are different approaches that are complementary to each other. Obviously, there is a need for case management services and information and referral during the early stages of job search. Healthcare-based interventions, they probably will span across the life course of an individual, depending on their specific healthcare needs. And these newer approaches of reaching out to employers might be more valuable when you think about retaining a job or advancing or increasing potentials for earning. So I feel like these interventions might be helpful at different points in time rather than pitching it against each other.
I think another area where employers might take a sort of more front and center role is in the retained demonstration, and it would be really interesting to see how those demonstrations are implemented in the services they offer. Like a big part of that might be because when the objective, like in retain, is to help workers stay connected to the labor force and to employers, looking at things like accommodations and the role of coordinating information between healthcare providers, employers, and all. So I think that there will be a lot to learn from the experiences that the states have with retain and other attempts to, involve employers in efforts to help workers stay at work and remain working.
I mentioned one other potential opportunity that we're exploring under the Next Gen project, which I've been involved in, and somebody mentioned it earlier today. There are an increasing number of vendors who provide disability inclusion services to employers, so they help employers make their workplace a more welcoming place for people with all kinds of disabilities, and also help them recruit and onboard people with disabilities, work with accommodations and that sort of thing. And I think there's those sorts of services have a great deal of potential to help employers hire people with disabilities. And I think we're looking at a test where we will test the ability of services to actually connect people who are at high risk for SSI to jobs that are available at those employers. So that's another example, I think, of where employers can be involved.
I also wanted to add that another avenue that we could possibly explore is through VR counselors. Most VR agencies also conduct outreach to employers. I think it's the demand pull model, where counselors provide one-on-one training and education to employers, HR managers. So that could be another existing connection that we could leverage on.
Thank you all. Another question from the audience. Can you describe the impact of SSI and SSDI benefits counseling paired with local and state benefits and public assistance? So does the benefits fidelity model take into account local and state benefits and public assistance? And particularly, I think this question was about being very specific about what we mean when we say fidelity and what we mean when we say benefits, what benefits we're referring to and what fidelity means. So I think this is Vidya, if you'd like to take the first response to this, and if others are welcome to weigh in after.
Yeah, sure. So among the studies that I reviewed, I actually did not come across any that looked at the impact of the combined impact of benefits counseling for both the state and federal benefits. So that's something that, you know, might need that the overlap of state and federal benefits might be something that we need to dig deeper into. And as far as the fidelity model, what that is making sure that, you know, when we design an intervention, you know, with certain theoretical underpinnings in mind, with certain target population and target outcomes, the way the program is implemented, it actually matches the original researcher's design or intention. And there are definitely challenges when we're moving from a highly controlled environment where we're conducting research to real world implementation. And like you pointed out, you know, that overlap between state benefits and public assistance and federal benefits, that's definitely will be an issue. Thinking about what goes into a fidelity metric, it includes two components. One is the content of the intervention, the different components of the intervention. And the second is the structure of the intervention. Under structure of intervention is where we would specify things like how often does a counselor meet with the beneficiaries, what modality do they use to communicate with the beneficiaries, what kind of training is required for the counselors. And these are things that might be easily standardized and can be described in a way that meets the requirements of different states and different programs, versus we might need to have some flexibility as far as the content is concerned, so we can accommodate for variations at the state, local, and federal level. So, you know, like Leslyn had mentioned previously, it's not about having a one-size-fits-all or a uniform metric for fidelity, but having minimum requirements that say that, you know, counseling programs should include these components at minimum, and based on the unique needs of states or populations, we could add additional components or modify those content components.
If I could just jump in here as well. So state and local benefits are included in every benefit summary and analysis that is done. It's a requirement of the WIPA program. You can't just worry about the federal benefits. You can't just worry about the healthcare benefits. Each of those benefits, some of those benefits are very specific to states. If you know one Medicaid program, you know one Medicaid program. It also impacts, very, very important, so that every time a benefits analysis is done, the impact on local benefits and state benefits is included in that. Some of these benefits are based on like family eligibility. And so depending upon what happens in terms of an individual's increasing employment and increasing in earnings may negatively impact a family's eligibility for certain benefits. So housing, food stamps, all of these things are included as a part of that. The VCU National Training and Data Center maintains a database of state benefits according to a format that's required in our contract with Social Security, that is accessible by individuals that are working in the WIPA projects. And so this type of thing is just a crucial component. You can't do benefits counseling without analyzing the effect of employment on state and local benefits.
Okay, that's all the time we have for questions today. We have a record of every question that's been posed, and they'll be forwarded to the presenters for their reference as they revise their remarks and publication.